good afternoon, and even good evening, depending on your time zone. My name is Antje Becker-Benton, and I am the Senior Advisor and Team Leader for Behavior Change and Community Health at Save the Children, based in the US. And I would like to welcome you to the Food Security COVID-19 Learning Event and today's lightning talk. It will be about the Malawi Risk Communication Community Engagement radio show and digital messaging during the pandemic in Ethiopia. We have, before I introduce you to the speakers, I have a couple of technical announcements. So I would like to encourage everyone to introduce themselves in the chat box, as many of you have already done, with your name and where you're calling from. Please note, if you have any questions during the webinar, to post those questions in the Q&A box, which you can find at the bottom of your screen. Please do not include the questions in the chat box. It makes it easier for us to go through. And all questions will be answered during Q&A at the end of the session. Some technical announcements. We'd like everyone to be aware that we will be providing French and Spanish interpretation for this session. If you would like to follow the event in French or Spanish, please click on the globe, on the small globe at the bottom of your Zoom screen where it says interpretation, and then select French or Spanish. Once you've selected your language, you can choose to mute the original audio, or you can hear it in the background at a lower volume. For English speakers, please select English as your interpretation language and mute the original audio. If you have any technical issues during the session, please send a chat message to Ideal, and we will do our best to assist you. And now, finally, I would like to introduce our speakers for this lightning talk. First, we will hear from Arthur Nkosi from the Movement for Community-Led Development Malawi chapter. And Arthur will be talking about how they initiated discussions and addressed misinformation about the COVID-19 vaccine on a grassroots radio show. Our second presenters are Gregory Makabila from Catholic Relief Services Ethiopia, DIFSA, and Arthur will be presenting on interactive voice response for empowered and informed decisions, together with Juanita Sackey from Viamo Technologies, who sits in Ghana. So first, with that, I will turn to Arthur Nkosi.
Thank you very much, Angie, and welcome to all of you that are part of this discussion. I am very proud to be part of the panel and to talk to everyone about the food security COVID-19 learning, more especially the Malawi radio risk in community communication engagement, and how we have been initiating discussions and addressing misinformation about COVID-19 vaccine. I'll move on to the next slide. A little bit of history and knowledge about Malawi. As you can see the map of Malawi there, we are located in the southeastern part of the continent in Africa, and we have been managing or collecting data in terms of the COVID-19 pandemic. And as of end of May, we had 34,304 cases. And the first round of vaccines, which is the AstraZeneca drug, arrived in March of this year. From the map, we have statistics, as you can see, the major cities, which are Lilongwe, colored in red, and Blantyre, also colored in red, where we had over 1,000 people that were infected with the COVID-19 virus. I'll move on to the next slide. So a little bit more about the COVID-19 impact on Malawi's food security. Malawi is a heavily agricultural-based country, and we have over 80% of the country that is involved in agriculture as work. The main crops that we have in Malawi: groundnuts, cotton, coffee, tea, and these are just some of the products that Malawi exports out of the country for us to continue with our country's economy buildup, as well as natural life. So for us, it is very important that if we're going to be able to achieve food security, farmers need to be able to farm, to be able to find the markets to function. And the only way that we can become food secure is to ensure that this pandemic does not take us over. And it is also important for us to ensure that we are all vaccinated. I'll move on to the next slide. Just in brief, the movement for community-led development here in Malawi, where I am the chairperson for the chapter, launched in 2015. And we have over 1,500 local community service organizations, 72 international NGOs, as well as different working groups within our chapter, such as that of COVID-19. I'll move on to the next slide. So for today's session, our goals are, by the end of the session, to allow you to hear about an example of how to organize a bottom-up community response to COVID-19. Also how this has been able to reach to community and provide a feedback loop where community members are able to ask questions about the vaccine. Secondly, you will hear lessons learned from organizing a discussion, a dialogue with the community. Thank you. Let me move on. This slide shows a publication that we did as the community-led development chapter to allow the general public to know that there will be a panel discussion on the Malawi Broadcasting Television, as well as the Malawi radio show. I'm going to talk a little bit about the three people that you see at the bottom there. And most importantly, for us to organize this event, we brought together a few organizations that were able to contribute to the launch of this panel discussion. The Hunger Project, Core Africa, Digital Associations, World Vision, and the Movement for Community-Led Development. I'll move on. This is another advert that we had publicized on the COVID vaccine awareness program through the radio station. And we had announced on the time as well as the dates that we would be doing the broadcast. I'll move on. So what was our need? Our need was in December 2020, the second wave of COVID-19 hit Malawi. And this also affected several leaders in our country who were affected and unfortunately had lost their lives. Because of this, there was fear, misconception, and also a lot of worry that set into the general public of the country. As the community-led development, we had seen a gap, and having seen this gap, we also saw that there was an opportunity that we wanted to make sure there was enough information about food security, poverty, as well as how do we roll out the vaccine. There were many challenges that we faced and that we had also seen in terms of communication, how the country of Malawi was collecting data in how many people were infected by the COVID-19 pandemic. So we had to mobilize our own resources and bridge this information gap so that we could allow the citizens of this country to get information on how to resist, or not to resist, let me say, the COVID-19 vaccine. And our response as a collective was to create a radio program in the vernacular. In Malawi, we speak Chichewa, which is our national language, and broadcast it on these two channels, the Malawi Broadcasting Television, as well as the Times Radio. There were a number of things that we had to understand as well in creating the logistics. ensuring that we are providing and diminishing the disinformation and misinformation, looking at the resources that we have, and most importantly, forging the partnerships that effectively engage the communities and the Malawi government, and also the Ministry of Health in disseminating information. So how did we go about this? We had worked on broadcasting 5 different hour-long programs to audiences in 27 of the 28 districts of the country. If you recall the map that we had shown earlier, Malawi is split into 3 different regions, North, Central, and South. And within these regions, we have districts. So the community members had submitted to us questions via phone, calling in. We provided a toll-free number for them to call in to ask questions. We also provided SMS numbers and WhatsApp messages, and we received over 200 questions based on rumor and, most importantly, the social media that was going around to different people in communities. So how could we, as the community for lead development, who are not vaccine experts, help convince Malawians of its safety? We embarked on talking to a number of different individuals within government who connected us to the experts. And if you recall, the publication that we had shown earlier showed 3 different individuals. These individuals were all medical doctors, people that were administering the vaccine, as well as people who were part of the COVID-19 task force for the country. And we wanted to create a communication cycle that started with communities so that experts could give feedback to their questions. If I can move to the next slide. Based on the feedback we received from the local communities, we felt the radio show was highly successful. Some of the questions, just to give you an example of what was asked, were, is the vaccine safe? Will it really help us to overcome the virus? Is the vaccine something that we as Malawians will have to pay for? And other questions such as, why don't we just use our local medicines within Malawi to be able to combat this virus? So we had 5 broadcasts, and we were able to do 1-hour sessions at 6 a.m. to 7 a.m. and from 6 p.m. to 7 p.m. The reason why we chose these times was because we wanted to ensure that we caught as many people listening to the TV and the radio station as possible. We still continue to respond to WhatsApp messages and SMS questions. And Malawi, having a population of 19 million people in all these districts, we wanted to reach out to 95% of those districts through the radio show, as well as the radio stations, in collaboration with the Malawi MCLD chapter. Because of this outreach, based on the feedback from the program, the Malawi government has engaged with the Malawi chapter to incorporate the radio programs into the COVID-19 awareness program. We are still initiating vaccines in the country, and only 1% of the Malawi's population has been vaccinated so far. To give you a perspective of the numbers, currently we have about 425,000 people that have been vaccinated either once or twice. And while still working with the Malawi government, we want to assess how the radio show has impacted the vaccine uptake. To continue on with this, just to give you a perspective, these are the radio stations that we are still continuing to work with to provide information so that we can reach out to as many of the Malawians as possible, looking at a number of 13 million. In summary, I believe that how you've heard the example of how to organize a bottom-up community response to COVID-19 with a broad reach to community feedback loop will give you an insight on how we were able to engage and allow the people of this country to be able to talk to us and allow us to give them feedback on their concerns. And also, I hope that you've learned from our lessons in organizing the dialogue with the community. There are still challenges, of course. And as I close, these challenges are challenges that we are continuing to work with as a group of NGOs, INGOs, CSOs, but most importantly, working with the Malawi government to ensure that we continue to battle this pandemic that we have in the country. I thank you very much for your attention, and please feel free to visit the website or feel free to email the email address that has been posted for more information. Thank you very much for your time, and I hope this session was helpful to you. Thank you.
Thank you, Arthur. Those were great insights for the organization of a bottom-up radio show with community feedback loop and impeccable timing, may I just say. Thanks very much, Arthur. And I'm handing over to Juanita and Greg from CRS Ethiopia and from Viamo.
Thank you so much, Anjit, for the invite, and thank you for the good presentation from my other colleague. We'll take you through our experience and process of how we managed to roll out an IVR platform, IVR interactive voice recording, to reach our clients, who we call the productive SafeNet clients. And just to start briefly, I'll start by going through what was the situation of COVID-19 in Ethiopia at that point in time. This initiative started in June because COVID came to Ethiopia in March 2020, and the numbers kept rising very fast. For example, between May and June, in May, the average daily numbers were about 50 or less. But by the time you're getting to June, the numbers had gone to more than 200 per day. And this rise in numbers caused us to worry. By June, we had more than 5,000 cases reported by the Ethiopia Public Health Institute. And as a result, we had to take action. The biggest issue we were facing is that, yes, COVID was being seen as an Addis Ababa issue because most of the numbers were being reported in Addis Ababa, but it was posing a big risk to our rural communities where we work. And just for a brief introduction now, where we work in 9 woredas. Woredas are like equivalent of districts, which are spread out within the vast Oromia region of Ethiopia. These areas are disadvantaged in terms of access, internet coverage, and movement is very difficult. At the same time, the government had identified options or measures to contain the COVID-19 pandemic. One of the options was, like, for example, people are not allowed to move around as much as they used to. Only 4 people are allowed to gather around. And this required us to find creative ways of hitting or reaching our clients. The promoted channels by most of the medias included social media and radio. And knowing the internet access challenges that are facing Oromia region of Ethiopia, our clients could not access internet, so they were kept out of the social media loop. The radio coverage and access at the household level among the 250 clients which we serve, 250,000 clients, was very low, and it was not good enough. So this meant, looking at the low literacy levels of our people and the weak internet and limited access to COVID-19 messages, it was impossible for them to be reached. So CRS and USAID worked together by using USAID approved messages and other measures. We decided to roll out a COVID-19 response measure that would help us reach our clients with information that is accurate on COVID-19. Inaccurate and inadequate information had made it difficult for even staff to travel to the field consistently because the participants were seeing them as the people bringing COVID to the communities. So this messaging was really needed. Internal reflection allowed us to use IVR as one of the main options, and I'll take you through the process of IVR in the next slide. So deployment of this interactive voice response mechanism took us 1 week because of the preparation we had, and we are building from existing investments. It had 2 phases. The first phase, whereby we had 6 standard COVID-19 messages developed by USAID and the government of Ethiopia, and translated into Afan Oromo, Somalia, and Amharic, which are the dominant languages in the areas where we operate. We added an SMS component later, and we also had a process of measuring access and understanding of the messages by the clients. This helped us to really know whether the message is reaching them and whether they're understanding it. And lastly, we had a creative dashboard that was dynamic to really help us know what areas to focus on, what kind of messaging to focus on. And these dashboards were useful for the program team, and we managed to get it to the partner level so that they are able to take decisions when needed. I'll invite my colleague Juanita to take us through the detailed process of how we managed to roll out the IVR platform. Thank you.
Thank you very much, Greg. I'll be taking us through the implementation process and the solution in Ethiopia in response to the COVID-19 pandemic. Just to buttress what Greg said, statistics shows us that about 80% of adults use mobile phone in Africa, compared to about 55% who have access to radio and 37% who have access to a TV set. With this being said, our approach of the use of IVR and SMS was our best bet to reach our audience. You may be wondering, what is IVR and SMS? IVR, which simply means interactive voice response, is a technology that allows a person to interact with a computer-based phone system through voice and phone keypad inputs. These interactions are with a pre-recorded voice, and callers make response through voice or phone keypad inputs, while SMS simply means short message service, which is a text messaging service for mobile devices. So these 2 approaches were adopted in the solution for our implementing partners. And the best part is IVR and SMS doesn't require internet connectivity, hence it wasn't a barrier. I'll briefly touch on advantages of IVR and SMS. So IVR and SMS saves time for everyone. It also creates a greater operational efficiency. And lastly, it creates better user experience. On the content design, the script was received from our implementing partners who ensured that the content was human-centered, and they adopted this in the content development stage. The content was focused and built around its users. Viamo ensured that this content was mobile friendly. Various design sessions took place to ensure that the content put together was given first-hand information on COVID-19, after which the content went live. The hotline was promoted as an ongoing food distribution activity in the 9 operational ROEDs, which Greg mentioned. The hotline went live on June 2020 to November 2020 for the first phase, and the second phase went live January 2021, and it runs till date. The hotline on an average receives about 1,375 calls monthly. Callers have access to various contents on COVID-19. Some of the key messages on the hotline includes symptoms of COVID-19, prevention of COVID-19, protecting oneself, how to support your family during COVID-19, miscommunication and misinformation around COVID-19, the need for social distancing, just to mention a few. So we had a live dashboard in place, And this provided monitoring and helped us to monitor all the activities that was going on. Further analysis was done, and we derived insights from the first phase to give us a better understanding of our users. The most listened to content on the hotline was symptoms of COVID-19 and prevention of COVID-19. The content was reviewed in December 2020 and updated to address more issues surrounding COVID-19. SMS was also developed to highlight the key takeaways from the content that was live on our hotline. The aim of these SMSs was to ensure that our callers can reference information on their mobile phone just in case they had to remind themselves. So how did we measure results? A check was put in place just after the key messages to ensure that our audience or callers understood what was being given to them. And about 75% of them, on the average, got the questions right. In concluding, I'll say this solution helped us to reach people in the shortest possible time, directly on their mobile phones and in the convenience of their homes, giving them access to key information that they needed on COVID-19. At this point, I'll hand over to Greg to take us through the lessons learned. Over to you, Greg.
Thank you, Anita. There are a lot of lessons that we've learned from the process and outcome when we rolled out this application or this initiative. One of the biggest lessons is the importance of reflection. We have an internal reflection process. We have an adaptive management strategy. And this helped us to really sit down and ask ourselves, what can we do knowing that our clients cannot be reached? So this helped us to identify IVR as an option after analyzing other options. One of the reasons why we selected IVR is because we had been using the interactive voice response for 3 years within the program, and we had learned a lot of things that can make it work and cannot make it work. So we pulled all that learning and brought it into this perspective. The second lesson is leveraging on existing resources. As we all know, when COVID-19 came, it came in a way that nobody had planned for it. So we didn't have like dedicated resources for that. So we decided to use existing resources. For example, we used existing messages that had been developed by the government of Ethiopia and USAID. We recorded those messages and then developed a script and worked on them. We also used, to market the system, we used our commodity distribution centers where it was happening already. So we didn't need extra resources to do that. We had existing staff, and most importantly, we had existing relationship with Viamo, which made it much easier for us to roll out this initiative within a week, which is normally not the case. The other thing is the importance of training clients on the use of technology. Having used IVR for 3 years, one of the biggest lessons we learned is that even though you might market the tool, if people don't know how to use it, they stop using it when they fail the second or third time. We learned this because when we're running our feedback mechanism, our analysis and discussion with communities, they told us that when they didn't understand how to use it, they stopped using it. So as a result, we incorporated training of clients and demonstration during the food distributions. You can see one of our staff holding the megaphone, trying to explain to people how to use these devices and how to explain the importance of the IVR and how they can use it. Those demonstrations were good because the clients were excited to listen to them, and we got good feedback from them, and we saw an uptick in terms of the users. The other thing is the importance of consulting users for further adaptation of the technology. One area we consulted users is when we are running IVR as a feedback mechanism, we faced one big challenge in the sense that out of the 255 calls that came in, only 30 of them went through. When we asked the clients, why is it the case? Why are you not completing the call? They told us that a lot of the information we were asking initially was about who they are, where they come from, why they called, etc. But they wanted to come and tell us why they called as the first thing. So we flipped the script so that the demographic information about who are you, where you come from, come last, and the messaging comes first. This helped us to see more calls going through and getting completed. The other thing we learned is the point of monitoring and acting when needed. We set up the adaptive management dashboard that was dynamic, that was telling us how many people are receiving the messages, which messages are being understood. And as a result, our staff kept picking areas where messages are not understood and disseminating those messages in other methods, including during trainings or other approaches. And lastly, appreciate and learn from your failures. IVR, we've done it for 5 years, and we've had big lessons while we were, for 3 years, and we've had big lessons while we were learning. One is the one I mentioned, whereby the script logic was not making sense to the clients, and we had to agree that that was a failure and change the script pattern so that we ask people about, we give people the messages first before we ask them the demographics, and it worked very well. So with those few remarks, I think we'll welcome questions. I'll hand over to Anjit to take us to the next process. Thank you.
Thanks very much, Greg and Juanita. That was great presentation of an intervention that used interactive voice response, so digital messaging and interactive voice response. So we've heard now from two very different channels. One with Arthur in Malawi was about a grassroots radio show that basically was self-organized and went with a lot of questions and provided answers to people in communities. And then we heard from Ethiopia about the use of interactive voice response, which is basically a platform you can call in your own time. You don't have to wait for the radio broadcast. Also, when you don't have a radio, you may have a phone, you can call in, you can listen to messages that were developed. I think both of them were fantastic examples of adaptive management, may I just say. Both rolled with the punches of this pandemic, which we all have, and adjusted basically as needed. So I can see there are many questions in the Q&A that we can now tend to. There's a variety of questions on the radio show, and let's start off with that. Arthur, do you think that this is a model that other communities could replicate? And there are a couple of questions that ask, what lessons did you learn? So there's somebody who tells us what's next with the radio show, but I think we can focus on what lessons did you learn? What would you say are the top 3 lessons learned from the radio show for others who would like to emulate that? That's also a question from somebody in India, where the pandemic is very strong at the moment. So people would like to learn from you. Arthur, take it away.
Absolutely. Thank you very much, Angie. I think let me focus on the first question, which is quite simple. I feel that this is a model that other communities can replicate. I'm going to speak in the context of Africa, but also having traveled around to different African countries where the radio stations are a primary key way of communicating with communities. And so I feel that it is a model that needs a lot of coordination and can be maximized on. The 3 lessons that I would say that we have learned from this are, firstly, timing is key. Timing needs to be synchronized in terms of understanding what is happening at the national level, coordinating with governments so that we have enough information as to the data in terms of how many vaccines, what is our goal in terms of vaccinating the population of the country, and ensuring that we then coordinate with stakeholders so that we can be able to communicate to communities and allow communities to respond or be able to initiate communities to ask the questions. The other lessons that were learned from this is data. Data is very, very critical. And this is something that as the community-led development chapter, we are still working with government on to gather enough information as to how many of the people that have been vaccinated heard about the vaccination through the radio show. That way we'll be able to assess impact, and currently we're still working through that process. The other lesson that we have taken from this is what kind of incentives can we put in place to the general population about the vaccines? This topic is about food security. and really to talk about how can this vaccine help us in ensuring that we have food security. Malawi being a country that is agricultural based, and a large percentage of the income generated into this economy is agricultural based, and what impact will the vaccine have on improving the food security within the country. So these are three areas that we learned and we are still continuing to learn.
Thank you very much, Arthur. I think now comes a question for both of you and all of us. I think it's a great SBC or risk communication community engagement question. How do you make the decision to choose either radio or IVR? So Greg and Juanita, that's also for you. I think Greg, you talked a little bit about that. You had some media dark areas and try to overcome that. So maybe let's answer this first. And then the follow-on question to that is it enough to only go with one channel? So maybe Greg first and Arthur. How do you choose, and is it enough to only go with one channel?
Thank you. The best way of choosing, experience is asking the clients, which channel do you prefer the most, and you have proper access to use. The second approach is to identify what is the coverage of phone, internet access, etc., so that you know exactly what kind of people you can reach. On the second question, usually people need options. Even though we were using IVR, we didn't shut down the other options. So usually it's better to provide options to the client so that they can choose whichever method suits them best. But we picked IVR because the other options being used were not hitting all our clients or most of our clients as we had envisioned to. The other reason we chose IVR is you can keep repeating the messages. For example, when we look at our statistics on the dashboard, we saw around 3,500 to 4,000 clients had made unique calls, but those unique callers had called more than 4 times each. So we had more than 15,000 calls. When we did our annual survey and asked people if they had received messaging using the COVID, we found more than 23,000 clients that we serve had actually received the messages through that channel. So you look at all those factors and you figure out what your clients need, what are the types of clients you're dealing with, where are they, and what kind of technology access do they have. Thank you.
So maybe briefly about the choice of radio and what other channels you interacted with, maybe.
Sure. I will talk a little bit about the radio and how we came to the decision about radio. Yes, Malawi does have a large population that have cell phones. And a lot of these cell phones are your simple cell phones. They're not smart cell phones that are in the communities. And so we felt that the best way to reach out to the communities was through the radio stations, and talking to the radio stations about their uptake in terms of number of people that listen in. And based on that information, we felt that the radio station was a good way of reaching out to the communities. When we look at the issue of the urban areas, there are a lot of people that are using smartphones. And so it would have been possible to go through and use the social media, for example, and broadcast through Facebook, Twitter, and all these other channels. But our focus was really about the communities, the people that are in the rural areas, and our best approach to reaching out to them was through the radio station based on the uptake of people that listen in, based on the other radio stations' feedback.
Oops, I need to unmute myself. Thanks very much, both of you. And so it's about audience data. It's knowing what populations use, but also trust, especially in pandemics. We have a couple of more questions about similar issues. I would like to use the question, maybe Juanita, any issues with women's access to phones, given that women usually take care of healthcare in the family, but phone ownership access is lower than men. So what do we know about that, and how does Viamo, for example, address this well-known issue? Women are not as much accessing. Do you have any information about that?
Yes, I think this is not really true because I've run projects where it targeted only women, about 3,000 women, entrepreneurs, normal people, even during the COVID-19 season. And we really had participation from them. I think we had one that involved women and how they can develop steps to take care of their families during COVID-19, and we really had a very good participation from them. But most of the time, I think the challenge might be using key parts, like trying to make input. But if it comes to listening to content and engaging, we also have a lot of women being able to engage with our content. And the best part is, for SMS and IVR, you don't need to have internet. You don't need to be connected to the internet. So we're able to reach people in very remote areas, and we're able to translate it into their local languages for them to understand. So that's like a very good plus for us, because you're able to communicate to people in their local languages and get them the information that they need.
Thank you very much. So I think the trick is there are data, and Viamo works with these data, how many women and how many men and sometimes youth have access to phones, and sometimes these data exist also for radio, and it is quite important to check on that, to know who has radio ownership, who has phone ownership, before we make decisions on channels. And I think overall we all agree, I think there needs to be a channel mix, so that can be mutually supportive, to make sure there are no gaps in feedback. So thanks for those questions. There are other questions. I quickly answer the one, I think, on the impact evaluation. There's a question, if we have data on the uptake of vaccines associated with exposure to message. And I doubt that Arthur and Greg, you have that yet, because these are real impact data. Do we have any of that, or is that something that could come later?
That's something that could come later. We've not done a thorough impact evaluation. We've just tried to measure whether the messages were, where people received the messages and whether they understood them. Yeah. We've not gone beyond that. On the point of the gender, one component is we made it a part of the messaging. So when we were marketing the tool to the clients during distribution, we highlighted the importance of making sure that even though there's only one phone in the household, you get everyone to get the message, because if you're the only one who has the message, the rest are going to be a risk to you. So making it part of the messaging made it easier for us to do that. Thank you.
Good point, to say like share this message with your family. Okay, very good. There is a question from Gitau. For Arthur, besides working the experts, did you work to engage community influencers? And if so, can you talk a little bit about how that process was like? Maybe keep it brief, because we have a couple of more very interesting questions. Thanks, Arthur.
Sure. Yes, we did engage with community influencers. In Malawi, more especially with church leaders. Church leaders are very critical in gathering many people to talk to them about the vaccine. Of course, we did have challenges because some church leaders were of a different view that maybe let's wait for the vaccine to be implemented in other countries before we implement it in our own community. However, through the collaboration with some of the community leaders, we were going to get a church leader to be part of the panel discussion. However, we wanted to focus primarily on the vaccine. But yes, we did engage with them, and we're still going to continue to do that.
Perfect. Thanks, Arthur. There is a quick question here for Greg and Kim, or if we think about, I think it's Juanita maybe, if we think about practical steps for pre-positioning in advance of future pandemics, or other crises. So this is about preparedness. What kind of steps could you take to pre-position the IVR technology so that that's ready to go for the next time?
Thank you. I can take a part of that. I think for pre-positioning, the first thing is to share the lessons we have learned, manage that knowledge and get everybody to know that this is how it works. These are things you can do, not to make it so it doesn't work very well or it works very well. Some of the mistakes we went through or gaps we faced, I'm sure people had already faced them. So really getting that information accessible to people in terms of lessons is good. The other thing is capacity, people, process, and technology. Trying to invest in those technologies as programs helps a lot. For example, why we were able to roll out IVR in 1 week is because we had been learning about it in 3 years when we started the DIFSA. So that learning from it, we already had existing phones, existing technology, existing partnership, and that made it easier for us. So trying to make sure the technology is accessible to development actors in an affordable way, that's very important. And then really communicating the processes that need to be in place to set up that one with different people. That's very important. And then the last thing is partnership for key messages during pandemic. Like creating content takes a good amount of time if you are starting from scratch. Our work was easier is because content had been created. All we did was to digitize and make it, put it in a script and use it. It had already been developed by the government of Ethiopia and worked on it by USAID mission. So that made it easier for us. So trying to put those steps in place makes it easier for prepositioning. Thank you.
And I hear Gertrude. Thanks very much, Greg. That's very helpful. And Gertrude has her hand up also. You want to come in? Gertrude, I'm not sure which question you wanted to contribute to, but please come on. Yeah.
All right. Yes, thank you so much. Great presentations. I had raised my hand initially because I wanted to respond to a question that was about which medium to use, radio versus maybe the SMS or the television. So in our case, as Movement for Community-Led Development, I think it is also important to have a mix of different medium used, because for us, we started with phone calls, communities making phone calls to radio stations where it was being broadcasted the whole country. So it was phone to the radio. Then after that, we had radio experts now giving response through the radio programs and also television. So we know that some people maybe could only have access to television, then they should be able to get the feedback from the television. Others could maybe only access TV. So they were also able to get, they were also able to get the information through the radio programs. So it should be a mix for us to be able to achieve better results.
Very good. Yeah, thanks very much, Gertrude. That's very true. And the intensity and repetition also plays a role. How many times have the same people actually received messages and engaged around it with dialogue? So there is a good question that is linked to that. Juanita, if you could tell us about if there is any experience of complementary work Viamo uses radio and IVR. So how has Viamo used radio linked with interactive voice response or vice versa? Can you give us an example?
Yes. Yeah, at Viamo, we've had a lot of projects that involves radio and IVR. Most of the time, if you don't know your targeted audience, let me put it in that way, and you want to target everyone. For example, this COVID-19 pandemic that hit us, radio spots could have also been used as a very popular tool. By this, we publicize the content on radio, maybe at a specific time. You should call into the line and answer questions or get content on this. So if it's related to questions, you'll be asked certain questions and will access your knowledge on that specific topic. Then we would design content where there were loopholes in the questions being asked, and since we've had the people calling in, we can push content to such people to educate them more on the topic at hand. So IVR and radio is very helpful, like working together with, yeah.
So quite compatible. So Viamo had radio shows even on their platform that you can listen to on your phone, and vice versa. There could be radio shows that then give the number of the Viamo platform to answer questions, or to basically hear answers to questions. So you can link the two up with each other, and that's quite helpful. Now I have a nice question for all three of us, three of you. What were the most surprising learnings that came from both initiatives? So maybe think of one that really surprised you, and what did you do about it? Maybe starting with Arthur.
Sure, thank you. It's a good question. I believe for me, let me talk about the chapter. What was most surprising is that government's reaction to the initiative that we took as a group of INGOs, local NGOs, as well as CSOs to build this up. Because the vaccines and the pandemic happened all so quickly that communication to communities was critical. However, the bottom-up approach was an area that we felt that was lacking. And so what really surprised us is the response rate that we got from all the questions that we received, the messages, the phone calls. That was really surprising. And it really was an eye-opener to learn about the concerns that communities have with the vaccine.
Thank you very much. And now over to you, Greg and Juanita.
Yeah, I think for us, the most surprising learning, and we did something about it, was just before we rolled the COVID-19 number, we were doing feedback and response mechanism. And one of the things we started seeing is most of the callers were not coming from our targeted areas. The same challenge that Juanita mentioned about knowing your target. We knew exactly our target. But when the numbers come in, yes, the message has been received, the feedback has been provided, but they're not coming from our implementation areas. And we started going back and forth with Viamo. Are you guys marketing our number in a different location than what we're supposed to do? And we did all the research around it, and we discovered like it's actually our partners who are working in many areas, and the staff felt this is a very good thing, and they were selling it beyond the target areas. So that has got both positives and negatives, in the sense that you have to look at every feedback that comes into it. And if you're looking at 60% feedback, which is not yours, it takes a bit of staff time. So we managed to manage them, to discuss the messaging and the where it cannot be messaged. And that was very useful for us in terms of learning. Thank you.
So the monitoring, the real-time monitoring along the way of especially media activities, and keeping the feedback loop with communities open so that we know that our responses are targeted and responding to what people need to know. Great, thanks very much. I am not seeing more questions, but I see that we have a couple of requests in the chat, namely the Reflection and Action Notepad. If you have time to reflect and capture your learning, please add it into the notepad, and please also don't forget to fill in a quick survey. If you could please take time for that, that's quite important for the overall organization of such learning exchanges. I also wanted to alert you before I thank our fabulous speakers here that in the next session, which is an interactive session, we'll talk some more about lessons learned, what has worked, and especially what has not worked. And Greg will be part of that. So you can, if you join the next session, you'll hear some more about our exchanges on what hasn't worked, because this is how we all learn a lot faster if we're exchanging about that. So with that said, I wanted to thank our speakers very much, Arthur and Gertrude, Thanks very much for your contributions, and Gregory and Juanita. Thanks a lot for the fabulous presentations, very helpful to all of us. And maybe let's just remember we're all learning during COVID-19. It's been a steep curve, and I'm glad that we can have this opportunity to exchange with each other. So thanks very much to everybody, and see you at the next presentation. Don't forget to fill out the evaluation.